Hello.
Hi.
How are you, Stephanie?
I'm good. How are you? Can you hear me okay?
Good, yes.
Good.
I love how it just works so fast like that.
Yeah, pretty good.
And your last name is Kagan, did I say that right?
Yes, Kagan.
Kagan. And do you go by
Yes.
Stephanie or
Usually Steph, but
Steph?
either's fine. Yeah.
Okay. Well, everybody, welcome to our Instagram Live with Steph Kagan, Nurse Practitioner. We're going to talk a little bit about her today. I'm Terry with Easy Healthcare Corporation, which is easy at home and all things Premom. So we're really excited to have Steph here today. She is one of our Premom virtual consultants right through the app. So we're super excited to learn about her, and you can get to know her a little bit and see if she's someone you'd like to work with. So yeah. So Steph, why don't you start by telling us a little bit about who you are, what's your background, your experience, and all that great stuff.
Sure. So I grew up in Florida, and I'm actually currently living in Colorado. So I've been a nurse since 2012. I was a labor and delivery nurse for about 3 years. I went to University of Central Florida, and then I decided I wanted to pursue women's health further. So I went to Thomas Jefferson University in Philly and got my master's degree there, specifically in women's health nursing. And ever since then, I've been in the field of reproductive medicine or reproductive endocrinology, which is specific to women's fertility. So I have spent the last 5 years working in a reproductive office, doing things like inseminations, IVF cycles, oral cycles like Clomid, letrozole, things like that, really managing fertility cycles for patients.
Fantastic.
Yeah.
Wow.
Yeah. So I've kind of seen both sides of the women's health field. You know, I started in labor and delivery, and now I'm back on the other side of helping women reach that goal. So it's pretty cool to kind of have seen the whole spectrum of start to finish.
Yeah, that really gives a complete picture, I'll bet, of the whole process.
Yeah.
Why did you choose to work with us at Premom?
So actually, I was really excited about this opportunity. Premom, I think, is an essential step to helping women get to that goal of, you know, expanding their family, whether it's their first baby or third baby. You know, a lot of these reproductive offices that I work in are not so accessible to patients. So this really changes the game for people to allow them to have access to providers like myself who work specifically in there. You know, some of these offices don't take insurances, or they don't take the insurance that the patient may have. So this really gives them that opportunity to kind of get all that quality information from being at home and not using their insurance or anything like that. And it's much more affordable for patients. And sometimes it's pretty intimidating to really, you know, make that call to a infertility clinic and say, hey, I need help. So this is a little bit more comfortable from your home. You know, you can sit there with your partner, your husband, your wife, and really kind of have that safety net of being home, not being so exposed. You know, they can choose to just chat if they don't want any type of video face-to-face, or the video face-to-face is awesome. I've done phone calls, we've done the secure chats. So it's really been great for patients to kind of ease their way into that field of taking that next step of seeking help for fertility.
Fantastic.
Yeah.
So what do you specialize in a lot of your work?
So when I work at the IVF clinic, it's mostly IVF cycles and things like inseminations. So we do cycle monitoring. So we're watching very closely, you know, LH surges, patients' hormones, how they're changing. And then I personally specialize in nutrition for women's health. So I also on the side have my own small business called Nourished Mama, where I help women who are trying to conceive, currently pregnant and postpartum, with the nutrition aspect of pregnancy and everything related to it. Because unfortunately, while there's so much information out there, it kind of pulls you in all these different directions. It's kind of like, which one do I follow? Which one do I start? So I don't believe in anything restrictive, any extremes. You know, I don't think you have to give up carbs forever. I don't think you have to never eat dairy again. You know, there's really healthy ways to kind of promote your hormone balance and everything. So a lot of the clients that are using the Premom app and they're tracking their cycles are really paying attention to hormones, but then we can also start adding in the nutritional component and try and help regulate cycles. So I specialize in a lot of unexplained infertility, PCOS. A lot of the PCOS patients that I work with have a metabolic or nutritional component. So they're at risk for high blood pressure, metabolic disease like heart disease, things like that. So when you pair the hormonal irregularities of PCOS with the nutritional component, I really work on matching those two things up to make sure we're getting, you know, as the longest strides we can towards reaching the goal.
Fantastic.
Yeah.
So who do you enjoy most working with? Do you enjoy working with those who are struggling with PCOS or similar challenges for fertility?
Yeah, so I really enjoyed PCOS. I had a huge PCOS following back when I was working in Pennsylvania, of patients who really were able to utilize the nutritional component. But really the most important thing to me is being adaptable, being willing to implement some changes. I can give you all the advice in the world. I can guide you. I can tell you, hey, these hormones we need to pay attention to, or we need to draw this lab, or make these changes. But if you're not willing to adapt or change, it makes it much more difficult. So anytime I see a patient, no matter what culture it's from or what their struggle is, everybody has their own struggle, whether it's a weight struggle, a PCOS struggle, endometriosis, something like that. As long as you're flexible and adaptable and willing to try some new things to help, push you towards that goal, I'm all game.
Awesome.
Yeah.
And you guys should definitely check out her Instagram. I was poking around there a little bit today. You said Nourished Mama, right?
Nourished Mama. Yeah. MOMMA.
I saw that you have at least one recipe in there, and you have a lot of great pictures.
Oh, yeah.
There.
Yeah, thanks. Yeah, I like to talk about specifics, nutrients like choline and folate versus folic acid, beta carotene, all of those little micronutrients that can really add up and make a difference in pregnancy, and, things that for when babies' eyes are developing in the womb, when do we need to be focusing on certain nutrients? And then when you're trying to conceive, certain things that you want to cut out, like canola oil and vegetable oil, all of those things are very, very inflammatory. And when you're trying to conceive, keeping that inflammation in your body as low as possible is absolutely crucial. So they help a lot of moms and moms who are trying to conceive, or women who are trying to conceive that aren't yet moms, really just reduce inflammation, regulate your cycle, try and get, because the more regular you're ovulating, the easier this all becomes. So Premom is fantastic because it really helps you kind of, that the app helps figure out each month when you're ovulating through all of the science and the data behind it. So if you start adding all these things together, we're really stacking the odds in your favor.
Yeah.
Yeah.
I wanted to ask you one more question.
Sure.
I don't know if everybody knows the difference between like nurses and nurse practitioners.
Yeah.
Could you talk a little bit about the different specialists
Yeah.
and what you do specifically, like the difference?
Sure. So I've been both a nurse and now I'm a nurse practitioner. So the difference is really the scope of practice. So as a nurse practitioner, I can really treat you as my patient when I'm working in the office. I can prescribe you medications. I can come up with a treatment plan. I work very closely with physicians to really implement the plan, as opposed to when I was a nurse, it was a little bit more the physician gave me the plan, or the nurse practitioner gave me the plan, and I helped kind of outline those steps for the patient. So as a nurse practitioner, we've been educated to take in data, come up with differential diagnoses. So if you give me the data, I can say, okay, it could be A, it could be B, it could be C, and then you work together with the patient and create that diagnosis to really help problem solve. So instead of, as a nurse, you're following steps, you're doing step 1, step 2, step 3 to help the patient. As a nurse practitioner, you're saying, hey, we need to think about what could step 1 be, what could step 2 be. So as a nurse practitioner, I can really help create and understand what's going on, rather than just kind of say, hey, do these steps in this order. It's more figuring out what those steps really are. So as a nurse practitioner, it's nice because we're kind of a middleman. A lot of offices will call us a mid-level, which some PAs and NPs don't like, but it is what it is. But we really are kind of that middleman between physicians and nurses. And with the physicians, sometimes they don't truly have time to sit down and go over the fine details. But as a nurse practitioner, we have usually more time. Our schedules are a little bit more flexible. So being an NP, and I specialized in women's health specifically. So I spent my whole entire nursing education on women's health specifically. So as a physician, you get to do a whole bunch of different things and really broaden. But then sometimes they know a little bit of everything. And then sometimes it's great to work with a women's health NP who's really, that's their niche.
Right.
Yeah.
That was a great description.
Yeah.
Love to have you on again, because
Sure.
you gave me all these ideas about us, and you mentioned endometriosis, and there's something else that you said. Obviously nutrition, because that's a big deal. So I'd love to set something up with you going forward so you could do a Q&A in our Facebook group.
Yeah, I would love if some of the clients that are using the app or following here on Instagram could send over some questions and stuff. We could always set up a live that could either be very topic specific, so we could talk about, nutrition in pregnancy, or I have a question. When do you recommend to see a specialist? And when can you expect during a consultation? So typically in the infertility world of insurance diagnosis, anybody under 35 has to try for a year in order to be billable or your insurance cover any type of infertility treatment. If you're over 35, it's 6 months. So that being said, if you do have any other underlying conditions like PCOS or endometriosis, those timelines don't really apply. So there's two different things I want to clarify for that person who asked. Seeing an OBGYN versus seeing a reproductive endocrinologist are two very, very different things. So seeing an OBGYN, they can technically prescribe you Clomid. They can give you that medication and say, hey, this might help you regulate your ovulation. However, when you go see a reproductive endocrinologist or a nurse practitioner like myself that works in infertility, the way we give you that medication and the monitoring that goes along with it is very, very different. So we would give you the medication, but we would draw hormones on day 2 or 3 of your cycle. We would draw them again on day 10, 12, 15, until we absolutely confirm ovulation. So the difference in seeing your OBGYN, tips for IUI, okay. So the difference for seeing your OBGYN is that they kind of hand you the medication and say, okay, good luck, I hope this works. But with a reproductive endocrinologist and people who specialize in fertility, it's here's this medication. Now we're going to see you back 5 more times this month, and we're going to tell you within 36 hours of when you're ovulating. So that's what's nice about the Premom app too, is it does with that LH, it tells you, hey, you're ovulating now, not just, hey, with Clomid, you might be ovulating in the next 5 days. So over 35, 6 months, under 35, 1 year trying, or just even actively, you don't have to be trying, but you can say, hey, it's been a year, I've been off birth control. We haven't been trying, but we haven't been not trying. That's when you should go see a specialist. If you have PCOS or endometriosis, you should start that process sooner. And then somebody else asked a question, successful tips for IUI. If you're doing an IUI in a reproductive endocrinologist office, you want to make sure that going into that cycle, your weight is optimal, you're exercising, you're doing all of those little things that can really add up and stack the odds in your favor. I always recommend patients to be taking a high quality fish oil. That would be something like Green Pastures or there's another brand, Pro Omega. So we can chat more and we can kind of get this information out. We can do a post if we want on Premom, and I can type all this out so that way people aren't like rapidly taking notes during this. But there's a few different options for fish oils, things like that. Really, you want to go into your IUI feeling as good as possible. And I do want to touch on weight, because weight is the one thing that you kind of do have control over. So sometimes, you know, we don't get to pick the stack of cards that we're dealt when it comes to fertility, but a 5% reduction in weight, more towards your optimal weight, or even 5% gaining weight if you're severely underweight, can really, really boost fertility chances. So for the person who asked about IUI, obviously I don't know you personally or what your weight is like, but just kind of make sure that's in line. There's another question here. Sorry, they're scrolling so fast I can't see them.
I scrolled through, I only saw the already, except one for me, I think. Back and look at.
If blood tests show you aren't ovulating, is that a fairly easy thing to fix? Yes. So I'm not sure what blood test you had, but probably a progesterone level. If that progesterone level showed that it's low, so less than 3, that indicates that ovulation did not happen. In that kind of situation, what we would do is prescribe a medication called Provera. Provera is a progesterone withdrawal supplement. So what happens is your body thinks you have progesterone. The progesterone goes away. Your body says, oh, no more progesterone, and your cycle starts. Then we would give you something like letrozole or Clomid to help stimulate your body to make a mature follicle. So to kind of touch on just the physiology of your cycle, the first half is an estrogen dependent, and the second half is a progesterone dependent. So estrogen is when your ovaries are working, growing that follicle, estrogen's rising. And then you have your LH surge, which is what Premom prides itself on, is really monitoring that LH surge. That LH surge spikes, and then within 36 hours after that, you typically have ovulation. After ovulation, your estrogen kind of plateaus and then stays steady, but your progesterone spikes up. So for the person who's asking about blood tests showing that you aren't ovulating, I'd have to talk more to them specifically. You can feel free to message me on Nourished Mama, and I can answer some basic questions for you. But if you want to set up a consult in the app, I can really set up, go into detail with you. But we can fix it with modern science. Also, there could be some things that we could do to just see if your hormones or inflammation is a little bit out of balance to help you get ovulating. So I have a 4-centimeter cyst on my right ovary. My doctor says it's nothing to worry about. Would an IUI be successful with the cyst? So it depends on the type of cyst, but yes, there are 2 types of cysts. There are functional cysts and simple cysts. Simple cysts are not producing hormones, so they're kind of there. They're a bug. Sometimes they can cause you some pain or some discomfort, but they're not pumping out hormones that would impact your cycle. However, if your doctor draws your estrogen level on day 3 of your cycle and it's through the roof, which it shouldn't be, then that cyst is making hormones and it's called a functional cyst. That could interfere. However, if your doctor, I'm sure, is monitoring your blood work and your hormones as well, you can certainly be successful with an IUI and an ovarian cyst at the same time. Next question. My husband and I are trying to start a family. I haven't been to a doctor in 5 years, but I'm 30, periods are regular and I'm very healthy. Should I go to the doctor and get checked out? Yes. So I do think you should go to the doctor and get checked out, just because you wouldn't want to be 4 months pregnant and then find out, hey, I haven't done a pap smear in 5 years and now I have this stage 2 something that needs to be taken care of, but then it's too high risk to do it while pregnant. So most likely you should hopefully be very successful in your pregnancy and getting pregnant quickly, I hope for you. But it's always a good idea to go into it and say, hey, what's my hemoglobin A1C? What's my cholesterol look like? Because pregnancy, although you feel young and healthy and great, pregnancy can really change things, and you don't want to end up with preeclampsia or high blood pressure or anything that can make your pregnancy high risk. Because you want to remember, the goal is one healthy baby, healthy pregnancy, healthy mom, healthy baby. So just touch base with your doctor. It doesn't have to be anything invasive, but just some simple blood tests to make sure that you're safe to be pregnant is the best thing that you can do for yourself. I've never peaked over 0.8. Is that low? Am I ovulating? So it looks like Kayla Fit here is asking a question about her LH tests. So the data that Premom uses and the science behind it, the numbers are quantified by how dark your test line is to your control line. So that may be different for everybody. Some may come up at 1.3, one may come up at 0.8. I don't want you guys to stress the numbers. If you're showing a change in, you're getting negatives, but still getting positives, and then back to negatives, it's still showing that LH peak that we're looking for. So if you want to talk more about are you ovulating, set up a consult. I'd be happy to talk with you more about it, but you could definitely still be ovulating with that 0.8. That was Kayla's question. And I think, Danielle has a question here. I was wondering the same. Last cycle, my peak was 0.8 and jumped to 1. Yes, that can be normal. So each month, LH surges are different in everybody. That LH surge may be 30, anything over 30 is a true surge when you're looking at blood levels. So the Premom app, luckily, because it's so non-invasive, is not looking at your blood levels. It's looking at just that control line versus your test line. So I don't want you guys to stress the numbers. 0.8, 1.0, 1.1, no big deal. As long as we're ovulating, having regular cycles, we can still be successful. I had a chemical pregnancy. Am I more likely to miscarry again? Two answers to this. If you had a chemical pregnancy and there was no fallopian tube involvement, no, you're no more likely to have another miscarriage. Usually a chemical pregnancy, what happens there is the embryo implants into the wall of the uterus. And at that point, it's a day 5 blastocyst. So that point is the cells are growing, the trophoderm around the embryo is expanding. And at that point, when the embryo implants, the genetics, mitosis, meiosis, all of that's happening. And when those cells are dividing and the DNA is all starting to line up, a chemical pregnancy is usually a misfire in the DNA. So when you have a chemical pregnancy, your beta HCG in your blood work is showing a positive pregnancy test. But luckily at that point, there are no structures present. There's no fetal pole, no heartbeat. So a chemical pregnancy shows that your uterus is able to implant an embryo, which is the silver lining in all of it. That's great news. However, it still is tragic. These patients feel usually pretty disappointed afterwards, but no, you should not increase your risk to miscarry again. However, if you tend to have a few chemical pregnancies in a row, I do recommend getting some genetics drawn, because you want to make sure that you and your partner don't have something that happened to both be recessive genetic problems that are lining up. So most likely the answer is no, but the only way to confirm that would be to draw your karyotype, which is your chromosomes and your partner's chromosomes, and some genetic tests. Thank you for answering my question. I also track with basal body temperature. So basal body temperature is a big part of Premom's app. BBT is great because you get very in touch with your body. And that's what I like about Premom, is it kind of doesn't take you from, hey, we're trying at home, to, hey, I'm thrown into an IVF cycle right away. It's very learning how your body responds, your cervical mucus, your basal body temperature. So keep charting your BBTs. That also will confirm, because we should really see that rise. So keep doing that. That's a good thing. Thank you. Can you have a consultation without using the 9-cycle tab in the app? So that may be a little bit more of a question for you, but what I think she's asking is the pregnancy guarantee. Yes, you can set up a consult by only being 2 or 3 cycles in. So I've worked with moms who have both done the 6 cycles and who haven't conceived yet. And they do they're part of that pregnancy guarantee. I've done those, and then you can come in right on in and set up a consult no matter how many cycles you've done. Obviously, the more data that you've logged, the more I can help you, just because I can see all of that information. I think that
more tab. If you go to the bottom right of your app, it'll give you all those little bubbles, and one of
yeah.
them is consultation. I think it's schedule consultation, so you can tap there and find everybody in there.
Yeah, so yep, it's the 3 little dots on the bottom, and then it will say schedule a consult, and then it will say like doctors, nurse practitioners, nurses. So I'm under the nurse practitioner column, and you'll find me there. My name is Stephanie Kagan. My headshot's there, and you would just click. I am based out of Colorado, but every night I have an option at 8 p.m. and 8:30 p.m. Colorado time. And then on weekends, I do an 8 a.m., I believe. I think it's 8 a.m., 12:30, right in the middle of the day. So no matter what time zone you're in, it's not too late. And then also the evening ones. And then I do try and throw in like a 5 or 5:30 p.m. consult in there just like once a week. Although my husband has to handle everything for 30 minutes. But I try and put it in there to be flexible. I've talked to moms in Los Angeles and moms in Georgia. So it's kind of all over the place, but we'll find a time that works. If for some reason there's not a time in the app that you're seeing that works for you, if you message me on here, I can try and open up some flexibility for you, because the more moms I can help just take one step towards that goal, the happier I'll be. Next question. After ovulation, my basal body temperature doesn't rise right away. It usually takes 3 to 4 days. Is this a bad sign? Do I have low progesterone? So the only way to diagnose low progesterone, and a lot of people, this is a lot of people think they have low progesterone. It's very, very rare. It's okay if your body takes a few days to rise after ovulation, because remember, ovulation is typically 36 hours after your LH peak. However, it may be 12 hours. It could be 36. So that day or two fluctuation is normal. I wouldn't stress it. However, if you're certainly concerned that you have low progesterone, there's a really easy test to do, and that would be a blood test. You can get it through your OBGYN or a reproductive endocrinologist. It would be drawing a progesterone level about 7 days after you ovulate. That progesterone level should be greater than 10. If it's greater than 10, you're good. Lower than 10, might have some low progesterone going on. You can cut me off at any point. I'm just trying to answer all these questions here. I don't want to leave anybody hanging.
Yeah, maybe we'll do a couple more and end it too.
Okay, sounds great. If your period is very irregular, can one still schedule for a consultation? Yes, absolutely. So this is a big part of the patient population I work with, are those who have irregular cycles. It's okay. That's what we're here for. We're here to help you understand that irregularity. If we can get it more regular, it's obviously easier to conceive. When you know that your window for trying is between day 13 and day 16, it's pretty small. When you have one cycle that's 28 days 1 month, and then 45 days the next month, and then 64 days the next month, it gets very, very broad. And the problem is knowing when you're ovulating is difficult. So for the lady that asked that, try and track as much as you can right now. It will help us kind of narrow it down. But also, if you've done any testing for PCOS, this would include testosterone testing, a whole bunch of different hormones. All of those lab values can kind of help guide us to understand why you're having irregular cycles, because the number one symptom of PCOS is cycle irregularity, which would mean anything greater than 35 days in 1 month and then less than 35 days in another. So yes, you can still schedule a consult even if it's very, very irregular. Oh, Mind is here. So I just talked to Mind the other day. She was so great. We're hoping that we got this figured out. So hoping for some great news soon. So yeah, if you guys have any questions, I'm always here. I get this. I've been working closely with women who are, in this emotional and financial and physical struggle for years now. I've been an NP for 5 years, specifically in women's health. So anyone that has questions, feel free to shoot them over, schedule a consult. Let's get the conversation started and get you closer to your goal.
Okay.
Okay.
Well, thank you. Thank you
Yeah.
so much, Steph. Now
Yeah,
you
you're welcome.
know more about fertility and how awesome Steph is. So please be sure check out her Instagram. Check her out on Premom under our consultation option. Now you know a lot more about what she does and how she can help you specifically.
Yeah, yeah.
And we definitely need to have you on again. You're amazing. So
Oh, thanks. Yeah, whenever.
we'll please let us know what topics you guys are interested in. Thank you for all the questions today. That was amazing.
Yeah,
Great
that was great.
conversation there. So let us know what you'd like to know more about, and we can get something set up and help you
Yeah,
on your fertility journeys.
yeah, definitely.
Anything you want to leave us with?
No, to all you girls out there trying, I believe in you. It will happen. We'll get you there. It's tough, but also reach out. A lot of people who are in this infertility struggle don't realize how many other people are also in it. So use your support system, whether that's us and whether we can help you, or talk to your friends, your family, talk to strangers and blogs, do what you need to support your mental health.
Okay.
All right.
Thank you everyone for joining us today. Please message
Yeah.
us, message Steph, and we'll see you on Premom.
Yeah, I'll see you soon, guys. Bye.